And you mentioned a little bit earlier, kind of about when nerves regenerate versus degenerate. But can you kind of just talk a little bit about the physiology behind when nerves do degenerate? What happens when the axon's transected? What happens? Any changes happen with the cell body? Any type of degeneration? Can you kind of just explain that or touch base on that?
Yeah, so I mean, the biggest thing that you think about what happens when a nerve gets injured is that you immediately have preparation for the nerve to regrow. So you think about, say for example, we have a nice example of a neurotometic injury, a Seddon 3 or a Sunderland 5, and the nerve is cut. And on the proximal end, there is preparation to regenerate that axon. So you get these macrophages and these Schwann cells that are phagocytosing all this debris. They're getting rid of all the junk. And then eventually you have these tubes that form, these so-called bands of Bunger. And you have this like axonal sprout coming from the proximal stump that's just kind of feeling its way out, trying to figure out where the distal stump is. And that's where you get things like a growth cone that is just kind of looking for the distal stump. And there are cues that you're going to get from the distal stump. So there's this, process of neurotrophism, in which you're going to get growth factors coming down, and you're going to get neurotropism with a P. This is a chemotaxis, is like this like pheromones like emitted from the distal stump to try to allure that proximal stump to grow down. But what's also happening on the distal end of the stump is that you have Wallerian degeneration. And this is again a cleaning house kind of process that starts on a cellular level, 3 to 4 hours from the injury, and it grossly becomes visible about 3 or 4 days, and it becomes detectable by EMG and nerve conduction studies by about 3 to 4 weeks, which is why you don't get a nerve study any earlier than 3 or 4 weeks. But in that Wallerian degeneration, it's disintegration of distal axon, distal myelin by these phagocytes and macrophages, and it is literally just getting the distal stump ready to receive the regenerating axon. And this was described when Waller was, experimenting on the hypoglossal nerve of frogs. So the big buzzwords for those of you that are taking exams is that this Wallerian degeneration, starts to occur pretty early. All of these processes are trying to get the nerve ready to regenerate across the proximal stump, from the proximal stump to the distal stump, assuming that the two nerve ends are somewhat, in the same neighborhood.
Yeah, and I think that's a good way to think about it and remember it is the you're getting ready for the nerve to regenerate. So what do you need to do? Proximally you have your your neurotropic factors that kind of help with the axon survival and extension back to where it needs to go. And distally you're having that kind of Wallerian degeneration where that axon is breaking down, distal to the injury, getting ready to receive that the new regenerated neurite or axon that happens about 3 or 4 days since it's transected. And